Whether you're sprinting down the field, landing a jump, or making a quick cut, your knees take a beating in sports. Today, we're counting down the top 5 most common knee injuries in athletes, how they happen, and what you can do to recover. Number 5. Patellar tendonitis or jumper's knee. Jumping, sprinting, and sudden stops put stress on the patellar tendon, which connects your kneecap to your shin bone. Over time, this repetitive strain leads to tiny tears in the tendon, causing pain and inflammation just below the kneecap. This is jumper's knee. Athletes will also often notice stiffness and discomfort when running or landing from a jump. Treatment usually starts with rest, ice, and anti-inflammatory medications, along with physical therapy to strengthen the surrounding muscles and improve flexibility. Eccentric exercises, where the muscle lengthens under tension, are particularly effective for recovery. Number 4. Meniscus tear. The meniscus is a C-shaped piece of tough, rubbery cartilage that cushions and stabilizes the knee. Each knee has 2. The lateral meniscus is more circular, and the medial meniscus is a C-shape. Both are attached at the front and back of the knee, allowing for mobility, but also making it a structure at risk of injury. A sudden twist, deep squat, or direct impact, especially in soccer, football, or basketball, can cause a tear. You might feel pain, swelling, or even a locking sensation in your knee. Some small tears can heal on their own with rest, ice, and physical therapy. However, larger or more complex tears may require arthroscopic surgery to trim or repair the damaged cartilage. Recovery time varies. Some athletes return in a few weeks, while others may need several months of rehab if surgery is required. Number 3. Medial Collateral Ligament or MCL Tear. The medial collateral ligament, or MCL, is a key stabilizer on the inner side of your knee. It's often injured when the knee is hit from the outside, common in football, hockey, and skiing. Depending on the severity, an MCL injury can range from a mild sprain to a complete tear, causing pain, swelling, and difficulty bending the knee. Mild MCL sprains heal with rest, but severe tears may require bracing and rehab, or in extreme cases, surgery to repair or reconstruct the ligament. Number 2. Anterior Cruciate Ligament or ACL Tear. Your anterior cruciate ligament, or ACL, runs diagonally through the middle of the knee and plays a key role in preventing the tibia from sliding out in front of the femur, as well as controlling rotational movements of the knee. An ACL tear is one of the most feared injuries in sports. It often happens without contact. A quick stop, change of direction, or awkward landing can be enough to rupture the ligament. Athletes often hear a loud pop, followed by rapid swelling, pain, and knee instability. ACL tears do not heal independently due to insufficient blood supply to the ligament, and while some partial tears may be managed with rehabilitation alone, complete tears usually require surgical reconstruction, particularly for individuals seeking to return to high-demand physical activities. In ACL reconstruction surgery, the torn ligament is replaced with a graft, with 2 of the most common graft options coming from the patellar tendon or the hamstring tendon. In a patellar tendon graft surgery, the surgeon removes the middle section of the patellar tendon. This graft includes small bone plugs from the patella and tibia, which is then shaped and prepared for insertion into the knee joint. Bone tunnels are drilled into the tibia and femur. The graft is then threaded through these tunnels, and the bony plugs provide strong fixation. Screws or other fixation devices are used to secure the graft. This method is highly durable and often recommended for athletes in high-impact sports. However, it can sometimes lead to pain at the front of the knee or discomfort when kneeling, due to the removal of part of the patellar tendon. Recovery takes 6 to 12 months, with a rigorous rehab program focused on strengthening and regaining full mobility. Number 1. Patellofemoral pain syndrome or runner's knee. Not all knee injuries happen in a split second. Patellofemoral pain syndrome, commonly known as runner's knee, is an overuse injury, gradually caused by improper tracking of the kneecap or patella in the trochlear groove, the shallow channel at the end of the femur. This misalignment leads to increased pressure and friction on the underside of the kneecap, causing irritation of the surrounding soft tissues and sometimes even cartilage wear. The pain typically develops gradually and is felt around or behind the kneecap, especially during activities like running, going downstairs, or sitting for long periods. Some athletes may also experience cracking or grinding in the knee when bending or straightening it. This condition is often linked to muscle imbalances, poor biomechanics, or tight lower body muscles. Treatment focuses on strengthening the quadriceps, improving hip stability, and correcting biomechanical issues like poor foot alignment or muscle imbalances. Athletes can often manage symptoms with taping techniques, orthotics, and proper training modifications. In most cases, early intervention prevents long-term issues, allowing athletes to continue their sport pain-free. Sports push your body to its limits, but smart training, proper technique, and injury prevention can help keep your knees strong and healthy. Strengthening the muscles around the knee, using proper footwear, and listening to your body can make all the difference. Stay active, stay safe, and take care of those knees. Thanks for watching. Please like this video and subscribe to our channel for more 3D health content.